Executive Director of Citizen Action, and thank you for joining us here today. I am joined by Kalamazoo City Commissioner Stephanie Bell, Marjorie Mitchell from MichUHCAN, Eli from Michigan Consumers for Healthcare, and Lonnie Scott from Protect Your Care. Our message here today is one that's very simple. The Affordable Care Act is working, and it's time for our Congress to get to work. And seriously, the 31st attempt to repeal the Affordable Care Act. We're standing behind us is the Family Health Center in Kalamazoo. And this center just received $9.3 million for renovations and advancement. That investment will directly translate into being able to serve more people in this country. And this was all because of the Affordable Care Act. I am glad to introduce City Commissioner Stephanie.
Thank you, Linda, and good morning. This facility, the Family Health Center, which is right behind us, is only one example of the benefits people all across Michigan are receiving as a result of the Affordable Care Act. I will now pass a press conference. As a result of the law here in the 6th Congressional District, 4,300 young adults in the district now have health insurance. 6,400 seniors in this district, the 6th Congressional District, receive prescription drug discounts worth over $3.8 million, an average discount of $590 per senior. 81,000 seniors in the district receive Medicare preventative services without paying any co-pays, co-insurances, or deductibles. 33,000 children and 120,000 adults now have health insurance that covers preventative services without paying any co-pays, co-insurances, or deductibles. 404 small businesses in the district receive tax credits to help maintain or expand health care coverages for their employees. 9.7 million people in public health grants have been given to community health centers, just like the family health centers, hospitals, doctors, and other health care providers in the district to improve the health of our community. Over 38,000 children with pre-existing health conditions can no longer be denied coverage by health insurers. These benefits mean something to me and to my constituents. They mean something to the people of this area, this very neighborhood. This is why I call on Congressman Upton to oppose the repeal efforts. I would now like to turn the press conference over to Eli from Michigan Consumers for Healthcare to talk about what repealing the law would mean for our entire state of Michigan. Eli?
Thank you very much, Commissioner Bell. And as she said, I'm with Michigan Consumers for Healthcare. We're a statewide advocacy organization representing over 160 different groups statewide that cumulatively represent over 5 million people in the state of Michigan. And when our elected officials are talking about repealing the Affordable Care Act, we need to look at what that actually means. It's not just a talking point. This will have real consequences. Repealing the Affordable Care Act would mean insurance companies could return to the days where they denied people coverage for pre-existing conditions. Repeal would mean over 23,000 Michigan seniors who've already saved over $17.6 million on brand name prescription drugs would be back on the hook for full costs. Repeal would mean 94,000 young adults in Michigan would lose coverage based on the one aspect of the law that allows young people under the age of 26 to remain on their parents' health plans. About 7,000 small businesses across the state would lose their tax credits that have helped them maintain or expand health coverage to their employees. And consumers could lose out on over $13 million in projected rebates from the overcharges of insurance companies. Michigan consumers cannot afford to go back to the days before the ACA, which is why we stand here with these groups today and call on Congress to oppose the ACA opposition and move on, denounce any attempt to repeal the Affordable Care Act. I now would like to turn over the press conference to Lonnie Scott from Protect Our Care.
Thank you. The truth here is that the citizens of Kalamazoo and the citizens of America are tired. They're tired of the rhetoric, and they're tired of the political wrangling associated with the ACA. But most of all, they're just tired of politicians who can't get over it and move on. A recent Kaiser poll showed that 60% of the American public would like congressional opponents of the ACA to move forward and move on. Only 38% say that they should continue to try and block the law from being implemented. But that's not what Congressman Upton is listening to. Instead, he has insisted on voting to repeal the law with no plan in place to replace it. Congressman Upton actually knows that he doesn't need a plan to replace the ACA because the votes that are taking place to repeal the law are simply for show. And it's a show that the residents of Kalamazoo, and frankly everyone across Michigan, is tired of seeing. A wise man once said that the definition of insanity is doing the same thing over and over and expecting different results. As we stand here today, this is the 31st time that the congressional Republicans have scheduled a vote to repeal the Affordable Care Act. 31 times they have tried, and 31 times they have failed. Yet they haven't scheduled one vote for a jobs bill. Not one. I believe it's clear that the people of Kalamazoo need jobs more than they need political rhetoric. They need their congressman to stop wasting time on political nonsense and start really working on issues that are important to them. They need someone who understands that the healthcare fight is over, that the winners are the American people, and that the only losers are the congressmen who continue to wage a war based on party affiliation as opposed to logic and what is actually best for their constituents. I stand here today to call on Congressman Upton to oppose any further repeal attempts. And I'd like to turn the press conference over to Marjorie Mitchell from MichUHCAN.
Thank you, Lonnie. MichUHCAN is a statewide education and advocacy organization on healthcare issues. And as we conclude this press conference, I want to make it clear to everyone that this act that was law is modeled after the law that Mitt Romney had enacted in the state of Massachusetts. And for good reason. That law has been in place and it has 98% approval rating as far as its people in Massachusetts are concerned. And it also has 98% of the people who are now insured. And when you have strong support from your people and you have insurance, you are making very good progress on the health of your people. The law is based on conservative principles. It actually came out of President Nixon's era. It was founded on conservative ideals. It should have, but wasn't, hailed as the biggest piece of bipartisan legislation that this country has ever enacted. But sadly, instead of supporting this piece of legislation that is helping millions of people around the country and around the state, in this congressional district, Congressman Upton chose to side with his political party rather than the people of his district. A final message is what we started with at this press conference. The ACA is working. It is good for people. It is good for the economy. And now we want Congress to stop the political and rhetorical lies in Washington and get back to work also, and things such as jobs. Thank you so much for coming. We can now take questions.
Thank you very much, and we welcome your questions. And again, we ask that Kalamazoo residents call Congressman Upton and ask him to support jobs bills versus